5 o'clock. Welcome to a special meeting of the El Centro City Council and the El Centro Regional Medical Center Board of Trustees. We're here to hear a presentation by UCSD on a proposed management agreement that would incorporate functions that UCSD would perform for the hospital, for El Centro. Ultimately, the end result of this would be better services for our community, improved health system for our community. So we're going to hear a number of people speak. I think this is a historic day in the city of El Centro, and after many years of attempting to find a partner that would run the hospital for the city, I think that the day is here. And it's the beginning of a long journey still, but definitely the wheels will begin to move in the right direction for the betterment of the healthcare services in Imperial Valley and particularly in El Centro. So with that, I'm going to ask our clerk to call roll call, please.
Mayor Silva,
Present.
Mayor Pro Tem Jackson,
Here.
Councilmember Sanders. Here. Councilmember Cardenas,
Present.
and Councilmember Villegas Walker. Here.
And we want to welcome our friends and colleagues with the Central Regional Medical Center. Your meeting started earlier.
That is correct, and thank you very much, Mayor, for offering your facilities to us. It's absolutely gorgeous, and I think maybe it should be consideration that we move the city council chambers to the hospital.
I think we'll decline that offer, Dr. Humphries.
We're back up from our recess, and we have already called roll.
Okay, thank you, Dr. Humphries. With that, I'm going to turn the mic over to our council member, Cheryl Villegas Walker, who really has been the spearhead on behalf of the council for a long time, and the discussions that ultimately have taken us here today on a proposed management agreement with UCSD, and then we'll hear from the UCSD CEO himself is here, and I'm sure that there'll be questions from the council, questions from the hospital board as well. Before I do that, any initial questions, comments from anybody? Ms. Walker?
Thank you, Mayor Silva. I think you captured it with a single phrase, and that is, this is an historic moment for the city of El Centro and, in fact, this entire community. As many of you in this room know, for a number of years, the city of El Centro, in collaboration with our Board of Trustees at El Centro Regional Medical Center, have been looking for the suitable partner for the hospital to enter into a management agreement with two key goals. One is, you'll remember that the city of El Centro is really the only city in the state of California that owns its own hospital. And we think about it that if this is such a brilliant business model, then why isn't everyone doing it? And so point number one, we needed to get out of the hospital business, mitigate the risk to the city of El Centro in the management of the hospital. The other thing is we know that we've struggled for a number of years with regard to the quality of care, the availability of specialists, our ability to recruit physicians to this area. And so we really went out with a dual purpose. One was to find a really top-notch partner to take over management of the hospital, but also equally important to all of us was to find that partner that would enhance the quality of health care within this entire community and, in fact, the region. So for a number of years, we have gone down the aisle, let's say, with a number of partners looking at different arrangements, affiliations, management agreements, maybe outright sale, you name it, we've investigated it. More recently, though, we entered into a dialogue with UCSD, and I think that it was true right from the beginning. We could sense that this was a perfect collaborative partner that would bring unparalleled expertise to the hospital and our ability to truly provide for this community. And I could not be more excited or happier about this moment and the fact that we are here and the fact that we're going to hear soon from Paul Viviano and I'll conclude my comments. Thank you.
Thank you. Mr. Bibiana?
Thank you so much for inviting us today. This is Patty Mason, who I think many of you have met. She's our Chief Strategy Officer for our health system. I'm struggling with a little bit of laryngitis, so I'll do my best to project as loudly as I can. It is a great honor to be here today on behalf of UC San Diego. As Cheryl has indicated, with the board and with the management team, we've been in discussions now for several months. And this is a very historic day for us as well. We see the Imperial County as part of our marketplace. We see us in a position to provide a great partnership to you, to help you meet the needs of the residents of El Centro and the entire Imperial County and this entire valley. And it is a proud day for us. We bring the entire strength and commitment of the UC San Diego School of Medicine and our health system to be your partner to help meet those needs. We bring our resources. We come to listen and to help respond to your needs. We think we have a lot of ideas about how we can help you improve the health of the residents of this community. We'd like to share some of them with you this evening. This has been a highly collaborative process, and we've started an assessment period that we think will translate into a very meaningful set of agreements that will memorialize our commitment to providing the care, to providing coverage, to providing new services, to providing management to support to your great management team. And so we're here to meet your needs first and foremost. We're not here to tell anybody how to do things. That's not our style. But we bring a lot of resources, and most important, the undivided commitment of the entire University of California. So again, it's a great honor for us to be here today. So I think you have this in front of you, and we'd like to walk through this briefly, and we'd be pleased to answer questions or address any concerns that you might have about anything that we're going to discuss this evening. So on page 2, we are developing a network. We know that in an era of healthcare reform, that having a broader network than just a couple small campuses in San Diego is going to be essential to our success going forward. We want to create an indispensable network. We want you, the El Centro Regional Medical Center, to be part of it. We view our marketplace as far beyond San Diego to include Imperial County, parts of Riverside County, and all of San Diego County, and El Centro Regional Medical Center and your community physicians are a cornerstone, a critically important piece of our delivery system as we envision it. And so to support the development of this network, we're committed to providing the things that are listed on the page to help deploy subspecialists. We've worked with your management team, and we know there are certain shortages of certain physicians in this community. We want to augment those shortages by working with the existing community physicians and bring physicians where and when those are necessary. We're not here to displace anybody. We've made a very clear commitment. We want you to make sure that every single patient who can be treated here in a clinically outstanding way stay here in this community. It took me 2.5 hours to drive here from San Diego this afternoon, and aside from my voice, I feel great. For patients to have to go to San Diego when they don't feel well should be done absolutely on a minimum basis. Our goal is to provide as much care in this community as we possibly can, and only those patients who really need either tertiary or quaternary service will be considered to be transferred to San Diego. Otherwise, we're committed to helping you keep those patients here and treat them in an outstanding way. We're creating what we refer to as a clinical integration network. and this is working with community physicians. You may know we have about 1,300 faculty physicians at San Diego, and we're augmenting our delivery system with community physicians. So we bring those community physicians, many of which are in this community, information technology, clinical pathways and protocols. We can add specialists to their practices. We can help them recruit new physicians into their group. And so we support that effort of recruitment to help you develop outpatient programs and services, to develop new inpatient services that are appropriate for the community, to help integrate the IT infrastructure that you have and we have to make the communication between our faculty and our delivery team seamless with your delivery team. We want to improve access. We're talking about transportation back and forth, not only for clinicians, but also for patients to get to San Diego in an easy way, again, only when it's required. To increase scale. We believe that scale and size matters in healthcare today. For you to take advantage of our purchasing power, our ability to contract effectively with health plans are all critically important. We bring expertise in revenue cycle, how we bill, how we collect from payers. And finally, a wonderful opportunity to brand El Centro Regional Medical Center as part of UC San Diego Health System. We think it's incredibly important to send that signal to the community. So Patty, I don't know if I've missed anything, but I invite your comments. Anything you'd like to add? Before we turn the page, any questions from this page that we can address for you?
Not yet.
Okay, we'll go on to page number 2. So this is a map of what we perceive to be the broad marketplace of the UC San Diego Healthcare Network. And you can see in the right-hand corner is Imperial Valley. And the cornerstone of our delivery system here will be the physicians affiliated with El Centro Regional Medical Center and the medical center itself. Our management agreement, which we'll talk about in a few minutes, we think help empowers that. We think we bring a lot of help to help manage. Our network extends all the way to the Coachella Valley, to southwestern Riverside County, and then throughout the entirety of San Diego County. We believe this mirrors how the health plans and others view this marketplace, a far more expansive view than we have had historically. We think it's appropriate and an exciting vision for how we can work together to improve the health of the communities depicted in the map. And so we have undertaken an assessment of this marketplace, and we're told by your management team and by your board that in certain medical specialties, there are physician shortages here. And so we're told that. We're going to work with your board and your team to verify that and create a plan. How do we add more primary care physicians in this community? How do we add very desperately needed specialties that are required? How do we augment existing medical groups? How do we bring physicians to this community to improve access? This is a community that has a lot of unmet medical needs, and our commitment, along with all of you, is to meet those needs in a more effective way. We know this population is going to grow, and not only is it going to grow, but it's an aging population. Many of the diseases that we treat, of course, are correlated with aging. So we want to be prepared to meet the needs of the community as it both expands and it ages. So we see the transfers listed at the bottom of the page. And our goal, one of the metrics we're going to report to you on an ongoing basis, is how we can reduce the number of patients that are transferred elsewhere so that we're able to treat those patients here in this community and provide outstanding care to those patients. So again, here are the gaps that we've been advised exist in the medical community And again, we're working with the hospital and one of the largest medical group in this community who we have an existing relationship with in our brand new clinical integration network, the Imperial Valley Medical Group. And so we're working together to identify and fill these gaps, how we can provide these medical specialties in this community in a seamless manner. I won't read the list to you. It's a long list. It's an impressive list. And again, we're committed to help filling and meeting this gap. So a management agreement helps with managing the creation of our faculty, community physicians, working together to optimize care, to improve quality, to minimize transfers, and when those transfers have to occur, to ease that access, to make it easier, faster, more efficient, to get those patients well as quickly as it can happen clinically and get them back to the medical community here, get them back to their family and their loved ones so they can enjoy the support network of their loved ones in this community. So the management agreement details are outlined at a very high level here, and I don't know if you prefer to have legal counsel address these or if you'd like me to walk through them. So this proposal entails that we would have an exclusive opportunity to manage your hospital. And this includes all the operational aspects of it, as well as the business functions of it. We envision your CEO would report to me. The rest of the management team here would continue to report to Tomas. The policy-making board, the policy-making would continue to reside with you. We're not here to make policy. We're here to make recommendations to you, to give you the information that you need in order to make well-considered, full decisions about what's best for this community. And it becomes our obligation, our commitment, to implement those policy decisions that you make in an outstanding manner. And we will bring, again, our full resources to help your management team. The management team at El Centro Regional Medical Center will have relationships. We refer to them as dotted line relationships with their professional colleagues. So your CFO will have a dotted line to our CFO so they can share best practices, learn how we do things, take advantage of some of the things I've referenced, how to bill more effectively, how to improve revenue cycle, how to contract with health plans more effectively, how to purchase things at better prices. We can collaborate and work in that fashion, just as the 5 CFOs, 5 CEOs, 5 directors of nursing, 5 HR executives, et cetera, manage together in the University of California. So we have 5 health systems associated with 5 medical schools, in addition to UC San Diego, UC LA, UC Irvine, UC San Francisco, and UC Davis. We have colleagues at those other institutions. We work together, share best practices. You would become part of that family of those great institutions, and you would be welcomed with open arms in the University of California to help you manage more effectively. So we've undertaken a 90-day assessment scope, and we will return at the end of that 90 days with a series of explicit recommendations of a management structure, timelines, what we believe we can accomplish. Our fee structure will basically reflect our cost. We want to make sure this only brings great value to you. We're not in this to make a nickel on management fees. There are companies that do that for a living. We don't do that. We want to bring value to you so that as you realize value, you will be pleased with the management services that we provide to you. And so we have the opportunity for this to evolve to other things, should you wish them to, but we're just thrilled with the opportunity to bring our management strength and expertise to you to help improve the performance and you meeting the needs of the community. So the next slide reflects what we call the UC San Diego Healthcare Network. And our hospital affiliates, and right now we hope that's you, but we will have a broad management and clinical services agreements. We will extend our brand, the University of California, San Diego Healthcare System, to you. And again, there's a manner in which our brand is governed. We've depicted it here. No one else has this brand architecture or capability today. We're in discussions with a couple other hospitals, not in this community, that may evolve to the same stature. They would be within that broad geography that we described. You may have read about some of them. And in addition to that, of course, we're working with physicians in the community that will be branded as part of the network as well. And so here's kind of a high-level view of what this could look like. This would be subject to your review and approval. We think this is handsome and an attractive depiction of what our relationship could look like on a website and in branding material. So there are lots and lots of other things we could talk about, but I think it'd probably be more effective if we had an opportunity to address your questions or concerns.
Let me look first at the council to see if there's any additional questions. We met earlier in closed session as it related to still the details of the management agreement. So I think Patty will attest that earlier today there was a lot of questions and where we got those questions answered. So I don't know if there's any.
She told me she got all the hard questions.
She did.
I appreciate that.
So I don't know if there's any additional questions from the council, or perhaps are there questions from the hospital board?
No questions?
Yes, Mr. Mayor.
Ms. Sanders?
Thank you. You're right, we did have quite a robust discussion a little earlier, but I still want to ask several more questions.
Please.
And that is, as we're moving forward with the branding, I think I like that. We're moving forward with bringing in new service line or strengthening the ones we currently have. So I'm going to make some assumptions. That will also include all of the support staff necessary to carry out those functions?
That's correct.
Okay. And in addition to that, then, while we're able to do things with, you're going to be able to capture those patients that are currently being transferred out in order to enhance the financial and our, I want to say, our bottom line. Is that what I hear you saying?
That would be one of our goals that we'll track and report to you. We want to minimize the out-migration, and we think by enhancing the quality and breadth of your services that we'll be able to keep more patients here. So there are lots of ways we think we can improve your performance. We don't want to sound self-serving or self-indulgent, but by
Please
providing...
sound that way for this discussion.
Right, but by providing more services here locally, we think more patients will be able to stay and be treated at El Centro Regional Medical Center and not be transferred elsewhere. We think that will help your financial performance, in addition to the management strength that we provide, purchasing goods and services more cost effectively, managing payer relationships, doing a better job with revenue cycle, managing just the infrastructure of the organization more efficiently. So we think we can add to both the efficiency of your operation as well as with enhancing the volume of patients that you currently treat.
Mr. Mayor, may I continue my line of questioning? The other question I have is it relates to those particular components that you've already addressed. But you know our current footprint. You're aware of that. And
Yes.
you're also aware that we're in the process of trying to expand the number of beds.
Yes.
And our surgical rooms are somewhat tight. So how then, explain to me, in terms that are extremely simple,
Okay.
how you're going to be able to do that. And I suppose that this 90-day window will be able to assess that. Am
That
I
is
correct
correct.
in that
Yes,
assumption?
that is correct. That's the right assumption. We'll come back with a very fulsome plan to address the specifics of your questions, the highest level, treating more patients and providing that care in a more efficient manner. And so in this marketplace, the appropriateness of care at a great value, at the right price, with great outcomes, with high levels of patient satisfaction, those four things we think will drive more market share to you, keep more patients here, which will allow you to generate the ability to expand and invest more in the physical plant.
Okay.
Very short answer. All those things sound easy. And again, I want to reiterate, we don't come with the answer exactly how. We're going to work with Tomas and the management team, roll up our sleeves, and figure out how specifically to do that by working closely with you.
Okay. Mr. Mayor, that concludes my questions for now.
And Mr. Mayor, I just have a follow-up question.
Cardenas?
Yeah, just in regards, again, thank you again. This is exciting, and I appreciate the interest that you have in our community, and just again, very excited about the collaborative relationship, the networking opportunity, and the overall scope of improving healthcare in our community. So it's very exciting. Just in terms of the 90-day assessment scope, can you kind of give me an idea when that actual, I know there's action before us today, but when would the 90-day scope
We've
start?
started.
I guess the official answer would be the 90 days would start at the execution of the contract, but we
Right.
actually have started, and we've got folks out here already working with the management team. We just put together today, over the scope of today, a very long list of consultants and internal resources that we have that we're going to have out here in the next 60 days. Poor Tomas is going to have to walk us all around quite a bit. But you know, the goal of the 90-day assessment period was really to come up with very distinct, discrete, measurable results that we can put in place, and then prioritize those over a multi-year period, hitting those things up front that will do improve your P&L performance, which we talked about earlier, as well as improve your clinical quality scores, which we think would be beneficial to the community as well.
And just to follow up, I know I see a couple different timelines. I see the 18-month timeline as well. So we would have the way I'm reading it is that there's and again, I apologize to my council members, I did show up a little bit late to the meeting, but in terms of the mutual evaluation of the long-term operating lease, that is an 18-month process, correct?
Right, so there are probably three key dates to keep in mind. In the 90 days, we'll be back with a plan to recommend. If we can't come to something that you are comfortable with within 15 months, you can ship us home to San Diego. We hope that you won't do that, but there's an opt-out there for you if you don't feel like the plan that we put together is going to provide the benefits that you're looking for. And then we have about an 18-month window to evaluate with you whether or not, you know, taking a more integrated step is beneficial, meaning a lease or something like that.
And just maybe after that 18-month period, just in concept, then the goal would be maybe some sort of five-year management agreement. Is that kind of the goal and the direction we're heading?
We're interested in a multi-year, whether it would be a multi-year management agreement or preferably a multi-year lease. But again, we'll negotiate those terms with you once you have the facts.
All right. Thank you, sir.
But that is certainly our interest, a long-term relationship.
Thank you. Thank you very much. Any additional?
I just have one question, Mr. Viviano, and it has to do with maybe a larger regional, statewide, maybe a national presence, and that is one of the things that we've struggled with from time to time is getting our voice heard, either in Sacramento or Washington, D.C. And do you feel that UCSD, as a health system, as part of a health system, actually has the ability to influence healthcare policy?
Well, I'm not sure any one health system's big enough to do that. We do have some advantages. We lobby together with the entire University of California. We do have full-time lobbyists on our behalf, both in Sacramento as well as in Washington, D.C. We are very active members of the broader associations, such as the California Hospital Association. I'm actually on the board. I'm the chairman of the San Diego Imperial County Hospital Association this year. So we're very active from an advocacy standpoint. We do our best to lobby with other members of the hospital industry where it makes sense. We've had some success lobbying with the CHA. We've had some success with the public hospitals in California have an association that we're very actively involved in. And so we do our best to put our best foot forward. And we've had some success, but as you know, it's very complicated,
Very.
a lot of different interests at stake. And safe to say that healthcare generally has become a huge business with a lot of different competing interests. But I think your ability to influence legislation is enhanced by having a relationship with the University of California. The governor happens to sit on our Board of Regents, and so he's open to dialogue and discussion. So we do have some access because of the University of California status. But it's something we work hard at.
Thank you.
Sure.
Okay, thank you. Any additional questions? Hospital Board, any additional questions?
I have a comment. Your presentation, My World, suggests you are a very humble consultant, that you are to advise the patient kind of what to do, advise the primary care physician what to do. And the contract seems, contract management agreement seems to have that tone. I would hope that as this evolves, this opportunity evolves, that you become a much more robust and authoritative position, more of the lead surgeon than the consultant. And that you mentioned that that you're looking to brand us as part of your organization. To me, that means that if it's successful, Health Central must reach the quality performance levels, the expertise, the customer service, the integration of the healthcare delivery system to match yours. And to me, to do that, you must take that surgeon's lead with us being the patient. And I can't see it to be a soft and fuzzy type contract where we'll all get together, kumbaya, and meet. There must be someone to lead, and I hope that is where you are going in this, that your expectation is that you are to lead, and that we are to then become part of your team and part of the trademark and part of the moniker, and that as you receive your accolades, as you receive a Baldrige Award or whatever it is, that we are part of that. And I hope that is your bottom line.
Well, I haven't been called soft and fuzzy in a long time, so I do appreciate that. So you're correct in that we're not coming here with the answers. We're coming here with an ability to help you find the answers, and we're going to earn that leadership position. And as we work with you and the management team, we're going to bring ideas and concepts, and we're going to help design a strategy that's going to distinguish you and us, because you're going to be part of our family, and we're going to earn that. And
You're going to lead the patient to the right decision.
I'm going to help
Yeah.
our physicians
Yeah,
in the
absolutely.
community and our faculty to get the tools and resources for them to lead the patients to the right conclusion. We're going to manage this in a way that's going to be very highly effective. When you look at the track record of UC San Diego over the last, pick a horizon, 5 years or 7 years, we've done our best to depict it in a very humble way. UC San Diego School of Medicine is a 43-year-old medical school, and it's the 17th ranked medical school out of 200 in the U.S., the 9th ranked research institution in the U.S. 11 of our clinical specialties that U.S. News ranks out of 16 are ranked in the top 50 in the United States. Last week, the leapfrog scores came out. We had an A score like we always have. I can go through the list. That didn't come from sitting back. It came from leading, and this is going to be a great partnership because we bring that skill and that commitment and that thirst for being the best, and we'll help you achieve that. and it'll be a great partnership because of that. But we're going to earn that position.
Put it in some type of historic perspective, your predecessor, the County Hospital, San Diego, the first urologist trained at the county hospital became the first urologist here in the valley, Jane Dickinson.
It's a great story.
So we're still here.
And
And here we are today with 1,000 residents and fellows. Roughly 250 of them graduate every year, and we hope many of them decide to stay part of our community, including the Imperial County. It's a great advantage that we bring as we open up the training to those residents and fellows to an opportunity to practice here, and that's very special.
And I think that the softness, Dr. Humphries, that you're referencing in terms of the language and the management agreement will be better defined 3 months from now, when UCSC comes back to us with definitive recommendations, definitive scope of what is intended to do. And again, even that becomes a starting point for additional relationships, additional structures that would ultimately result, again, to a better healthcare system for our residents. And that's the exciting
Yes.
part of all of this, you know, and we can talk a lot about what we're gonna do, but ultimately it just represents quality care for our residents, and that's the exciting part for
It
me.
is unbelievably exciting, and so I hope my failing voice can express the excitement and the enthusiasm that this means to us, and this means a lot to us. And we think that the future together is incredibly bright, and this is just so exciting.
Yeah, thank you, thank you again.
Mayor Silva and the city council, I'm very excited over this opportunity as a first step, and I think there's a resolution before the Board of Trustees that I would like to entertain any discussion or entertain a motion for that resolution.
I would make a motion that we approve. Thank you for coming.
My pleasure. Thank you so much.
Personal.
Is there a second to that motion?
I'll second for discussion. I just had a question on the resolution. In reading the resolution, it's my understanding that what the board is doing is making a recommendation to the council that they move forward with a management agreement on behalf of the El Centro Regional Medical Center. So it's not that we're approving it,
Right.
we're encouraging you to move forward with that. Just wanted to clarify that. It was a little confusing, but, and also just a little nitpicking in me. I think in the res at the bottom, we should probably reflect that the adjourned meeting was held at the city council chambers. We normally meet at the site of the hospital site, but just to reflect that we are meeting here. So.
I think the resolution's been published. Any further discussion? Carmen, would you call a roll call vote on this momentous occasion?
Trustee Humphrey,
Aye.
Trustee Brooke,
Yes.
Trustee Alvarado.
Yes.
Trustee Picasso,
Yes.
Trustee Sanders.
Yes.
Thank you.
And this is approval resolution number ECRMC 15-08 of the El Centro Regional Medical Center Board of Trustees, recommending to the City Council, City of El Centro, the approval of the master management agreement between the City of El Centro and the UC San Diego Health System and School of Medicine. Thank you very much.
Thank you very much. Thank you very much.
Thank you so much.
If there's no further business before the Board of Trustees, I would entertain a motion to adjourn.
Second.
Thank you, and the city council will reconvene for our regular meeting at 6 p.m. Thank you very much.
Efrain, can we get a picture of all of us? Somebody have a camera?
If somebody has a camera?
I'm glad I'm here, I'm safe, everything's okay. That is her, holy cow, I'm having a
Let me get somebody's name. I know you were part of that for a long time.
Oh, I think it's fantastic. It's 40 years late. I think it's getting started. The time is right. You know, Martin used to say, Carl, even though you're right, the timing is right. It's going to change. Now, finally, what do you mean it's right?
I saw you there when I came in, but you were busy talking. Thank you. I appreciate that. Thank you. This is the first step. This is just the first step. It's just like, yeah, remember like 40 years ago, we talked about that.
That's the Alvarado, I think they want you there.
Going back and working with Diana.
Mix it up or you want to stay siloed?
I don't know when I'm going to be back, but right now what I'm doing is I'm marrying up and figuring out which positions I would have to come over and adjust. Positions have conversations with your positions about what's going on, what we need, and we'll start putting all the information together.
Thank you very much. We are reconvening as the El Centro City Council for our regular meeting of Cinco de Mayo, 2015. Ms. Caldwell, is there a need to take roll again? Okay, please.
Note in the record.